Good night. So, welcome everyone. Myself, Dr. Tanema Singhal, and this is the Ask Me Anything session. And today I'll be answering questions related to breastfeeding. So, first I'll answer the questions which are filled by mothers on the form, and then I'll take the questions which are coming live in the Q&A box. So, if you have any questions, you can write in the Q&A box. So, starting first question from Vartika Gupta. My baby is not latching. It's been 1 month, 10 days. Milk quantity is also very, very low. Next to na hone ke according. Okay. So Vartika, see, the simple thing is about supply and demand. There is not enough demand because the baby is not latching, and that's why the milk supply is low. Also, because milk supply is low, so the baby is not latching, and when the baby is not latching, the milk supply is not increasing. So first, what we need to understand, the baby needs milk. The baby is hungry and the baby needs milk. So we have to improve the milk supply first, and side by side, we have to work on bringing the baby on the breast. So in this case, first you will work on improving the milk supply, and side by side you will try putting the baby on the breast by different techniques like mid bottle feeding, and if possible, because your baby is just 1 month 10 days old, so it will be better if you can start giving by katori or by palada, because that will be a better way of feeding the baby, so that the baby is not habitual to the bottle and can come on the breast when the supply is better. So how to improve the milk supply? This I have answered a lot of times, but I am repeating it again. The most important thing is hydration. Second is improving the flow of the milk. Third is putting the baby on the chest like mid bottle feeding or mid katori feeding or mid panada feeding. Fourth is you have to bring the baby skin to skin with you. Fifth is by taking some galactococs, and now you know galactococs are the medicines which help in improving the milk supply. So that you have to consult your lactation consultant, who will guide you about what medicines to take to improve the milk supply. And once you start putting the baby on the breast for every half of the palada feeding or the bottle feeding, and this should be done for every feeding. It is not like if you're trying for 1 or 2 times and expecting the baby to come on the breast like that. It will not work that way. You have to try each and every feed. So if your baby is feeding for around 8 times, you have to try at least 8 times. And then maybe the baby might come starting 1 or 2 times, but it is good. And if the baby is coming even for few seconds, 1 or 2 seconds or 3 seconds, it's okay. Don't think that everything will work like wonder. It will take little time. So you have to keep patience and perseverance and keep moving into that. Okay, Vartika? Now moving ahead, next question is from Anjali. How to maintain milk quantity after treatment? Good question, Anjali. So Anjali, once the milk supply is good and it is like full for your baby, then maintenance always involves demand and supply. The same concept. If you keep creating the demand, the milk supply will not go down. And for your satisfaction and your knowing that whether everything is good or not, you have to keep checking the weight every Sunday to Sunday. If you are checking your baby's weight regularly and the baby is on exclusive breastfeeding and the baby is gaining weight properly as per the protocols, then you are good to go. You don't get confused by somebody telling you that you don't have enough milk, or you feel whether the baby is getting enough or not. That is by only checking your baby's weight. So this way you will keep maintaining the milk supply. And if you are my patient and you have been into the treatment of me or my doctors, then you would be knowing that when we close the treatment, we also give the maintenance protocols. So if you are following those maintenance protocols, you will not have any problem in milk supply going down after completing the treatment. Now, next question is from Asifa. Asifa says, correct position in latching. Now, Asifa, you have not mentioned what is the age of the baby, how much milk supply is there, is the baby taking formula feed also or not? So because this is a general question, so I'll answer it in a general way. So correct position in latching, what I always have seen, if you are facing any issues in latching, then cross cradle hold works the best way. And if your baby is like 4 months and above or 3 months and above and already been on the breast and regularly feeding, but it is not going very well, but still then latching can be resolved by cradle hold also. So these 2 ways are the positioning. And if you have a twin baby or if you have a heavy breast and you want to feed your baby regularly, then you can also follow the football hold. And if you're a mother, if you're just a new mom and your baby is doing cluster feedings also in between, like in evenings, if the baby is doing cluster feedings, then sideline position also works for you. If your baby is more than 5 months and is already on breastfeeding, exclusive breastfeeding, and you want to just feed the baby because the baby takes for a lesser time, then you can also feed the baby in sideline position. So these are the positions which you have asked in general. So because I don't know the status of your breastfeeding, so this is a general reply accordingly. Next question is from Anjali. Different amount of milk supply in both the breast and baby is refusing my breast. Okay. So Anjali, first question is different amount of milk supply in both the breast. Now when I talk to you about milk supply, I'll tell you each and every mother has the same thing. She has one side milk supply better than the other side. I can say around 98% to 97 to 98% mothers have the same thing, which is even like, which is very normal. If you see also about the size of the breast, even that is different. One size breast is different than from the other side. So milk supply also, it is not like both the sides of milk supply should be same. It can vary. It should be the main thing is your baby should get breastfeeding, like should be on exclusive breastfeeding without any formula, and the baby should gain weight properly. If this is happening, then that is not an issue about having different kind of milk supply for both the breasts. But if you are giving formula milk to the child and you want to increase the breast milk, then the side which has lesser milk, you have to work on creating more demand that side. So if you are an exclusive breastfeeding mother, or if you are a breastfeeding mother and giving formula also, then first start from the side where the baby is having less breast milk, or where you have less breast milk. First start from that side. Then once the baby starts crying or the baby is not full, then shift to the other breast. But at the end, when you are ending the session, then put the baby on the breast, on the side where there is less breast milk. You put the baby also on that side for a few minutes. If the baby is not ready to latch, then you can hand express or pump for a few minutes to improve demand on the side where there is less milk supply. So the main concept about increasing milk supply is demand and supply. So if the milk supply is less on one breast and you have to increase, if you are giving any formula milk or any milk, then you have to work on creating more demand on the side where there is less milk. Okay, Anjali? Also, you have asked one more thing, that my baby is not latching and baby is refusing my breast. So if the baby is refusing your breast, then as I just told to Vartika also, that you have to try for mid-bottle feedings. If possible, if your baby is small, you can even try for katori feedings or the palada feedings. So and keep trying in between. And we should be always tried for all feeding sessions. It is not like that you just tried once or twice and you are saying the baby is not coming. You have to try each and every time. Because see, even when you think about yourself, you're not same hungry full day. Sometimes you are more hungry, sometimes you are less hungry. Also, throughout the day, you don't feel hungry the same way. Mornings you might be more hungry, or mornings you might be less hungry, but more hungry. So same applies for the baby also. What is the mood of the baby? How is the baby like coping up? So you have to try each and every feeding sessions, as I told you about the mid bottle feeding or the mid katori feeding or the mid palada feeding. And then after continuous like trying for 1 week, the baby is still not coming, then you can say my baby is refusing breast. Other than that, by putting less efforts, you just can't blame the baby. You have to also give equal efforts into that. Okay. Then moving ahead, next question is from Lakshmi. Can exclusive breast pumping can increase milk supply? Yes, Lakshmi, you can exclusively pump and improve the breast milk supply. Now, let me give you an example. We in India get at least maternity leaves for 6 months. But when you talk about outside India, there are many countries which don't give maternity leaves to mothers. They have to join their work like immediately after delivery. Then what do? They have to go for their office also. So those mothers usually go for pumpings. You can see very common trend in US. So there the mothers are already exclusively pumping and giving their breastfeeding. Even in India also, it is very common these days as mothers are on exclusively pumping and giving breast milk to their babies without any formula milk. And even in my patient base, what I can see, I have a lot of mothers who are exclusively pumping and giving their breastfeedings. It is basically because of the cultural traditions in India. We feel that if the baby is not latching on the breast, the baby will not get exclusive breastfeeding. But this is not correct. you can exclusively pump and create that kind of demand for the brain to understand and improve the milk supply or increase the milk supply accordingly. And that is the reason relactation cases also work in. We have so many cases where the milk supply was zero and now the milk supply started increasing. If there was only the condition that only if when the baby will latch on the breast, then only the milk supply will increase, this would have not happened. So exclusively pumping can also bring your baby on exclusive breast milk. It is basically the efforts which you have to make, and most important thing, the confidence you should have that yes, it is possible, and should not get worried about when people say to you ki abhi nahi hoga, it is not possible now. You have to just stay strong into that and keep connected with your lactation consultant who will keep guiding you on seeing your progress and accordingly change the protocols, basically customized for you. Now, next question is from Rashi. My baby is 4 months old. My milk supply comes to zero. How can I increase my milk supply and restart my breastfeeding journey? So Rashi, as I just told, because we are just talking about breast milk supply, because I understand this is a very common concern of mothers of low milk supply. So in my most of the webinars, I talk mostly and majority times about how to increase the breast milk supply, Rashi. So I've already told right now, I think I told to Vartika about improving the milk supply. So basically it is about hydration, it is about flow, it is about some galactogogues, about the medicines which I prescribe or we prescribe as doctors from Maa-Si Care Clinic. So as you all know that we have other experts also. I am not the only doctor right now in Maa-Si Care Clinic, so we have more doctors. So you can, if you are feeling any kind of issues that you are not able to breastfeed your baby, you can definitely contact us and we will be there to help and guide you there. So Rashi, I have already covered this. You can just go through the recording also and you can just go through it, how to increase the breast milk supply. Next question is from Medha. My 5-month baby is relying more on formula than me. Supply issue too. So Medha, your baby is 5 months old. Now it is already, time has really has gone now. Basically, I'm not saying that now we can't do. It is basically, I'm saying now don't waste time further. Your baby is already 5 months old. Now, please don't waste time in experimenting. Please come back, either go to a lactation consultant whom you know or come to us. We'll try our best to get the baby on breast milk as much as possible. Because already 5 months now, there is no time of doing experiments or by taking these free advices on webinars. It is now the time for action. You have to get a proper protocol done for you and you have to improve your milk supply. The baby is very soon going to start solids. So basically, Medha, don't waste time now here and get in touch with the lactation consultant or you can contact us. We'll be happy to help you. Next question is from Khushbu. How to know about your milk production? Good question, Khushbu. So how you will know about your milk production is by seeing the baby's weight gain. Now, I don't know what is the age of your baby, so I am giving you just general guidelines. If your baby is less than 3 months, baby should gain 200 grams per week. So if your baby is on exclusive breastfeeding and you just check the baby's weight Sunday to Sunday, and if the baby is gaining 200 grams per week, then you are good to go. Please don't get confused by P counts or here and there. Just see the weight of your baby. If your baby is gaining 200 grams per week, please relax and focus on other things. There are a lot of things which you can do with your baby other than breastfeeding. If your baby is doing exclusive breastfeeding and getting 200 grams per week, please leave that part. And now start focusing on other things like you can work for. There are a lot of things with like multisensory development which you can do for your child. Please focus there. Breastfeeding is all fine. If your baby is more than 3 months old, the baby should gain at least 100 to 150 grams in a week. And if on exclusive breastfeeding, please relax. So this way you will be able to know what is the milk production. And it is not only about the quantity of breast milk. It is also about the quality of breast milk. So when you mothers see 10 ml, 20 ml, and you start worrying, oh, I don't have enough milk. My baby takes 80 ml of formula, 90 ml of formula. What this 20 ml will do? You don't know what is the strength of breast milk or what wonders it can do. So you have to see the weight gain. And we have been seeing with our patients, even 20 ml of breast milk is able to stop the formula milk at a particular pace. It is not increasing at a particular time. As the baby is growing, the formula milk should increase. But we are seeing with our patients that after even a small amount of breast milk production, the formula is not increasing. So if the formula is not increasing, even that 20 ml of breast milk can like stop the increase of formula intake for the baby. So it has very good strength in breast milk. You should work on that. So basically the thing is, first start. If any one of you is facing any kind of issues in breastfeeding and you are still thinking about whether should I go for it or not, should I try, is it worth trying or not, I would definitely say it is worth trying for it. Because see, if you are thinking about it today, this will keep bugging you throughout your life, that I should have tried, I should have given some more time, I should have consulted somebody. So that thing will always be there in your heart. So that's why it is worth giving a try. And obviously you have an option there. If it doesn't work for you, you can talk to your doctor. If they're also saying that it is not working for you, then it is the decision when you can take, okay, it doesn't work for me. But your doctor will always keep you guiding, and you should always take the guidance of your lactation consultant. Just by knowing from people that it doesn't work, they don't know about you, they don't know about your body, they don't know about your baby. So this decision they are not supposed to take on your behalf. This decision should be discreet between you and your lactation consultant. Somebody else should not have that decision to take for you, and you should also not allow others to judge your journey. Okay, so this is your decision. So you should always take help from a guidance, from a guide, and take help accordingly. And that guide should be an experienced one, not like your internet or Google Baba where you are seeing, okay, this works, that doesn't work. Not like that. You should reach out to an experienced lactation consultant who has seen a lot of mothers, who are regularly seeing a lot of mothers, who can guide you well. Just by seeing internet or by just going through some random information, and you are taking such important decision of your life that way. So this is something which you need to think about and ponder about that thought. Next question is from Sudha, who says latching issues. So Sudha, this is a very general comment, latching issue. Before latching issues, there might be a lot of things. So you have to write in proper what all things you want to, what is your question clearly, so that I can answer it properly. Next question is from Sarita. क्या 1 साल के बाद रिलैक्टेशन कर सकते हूँ? हाँ सरिता, और आई थिंक सरिता आप मेरे पुराने पेशेंट हो, जैसे नाम से ऐसा लग रहा है, आप लोग कंसल्टेशन करके बीच में अगर गायब हो जाते हो, मिल्क सप्लाई कम हो जाती है, तो घबराया मत करो, ठीक है? गायब नहीं होना है, लेकिन इसका मतलब ये नहीं कि गायब हो जाओ. दैट जस्ट मीन्स कि अगर आपको किसी भी वजह से आप आगे कंटिन्यू नहीं कर पाए थे और अभी आपको लग रहा है कि क्या मैं अब कर सकती हूँ, तो हाँ सरिता, आप अभी भी कर सकते हो. नेचर ने इतना ब्यूटीफुल बॉडी बनाई है, इतना ब्यूटीफुल सिस्टम बनाया है कि आप उसके साथ थोड़ा भी काम करना शुरू करते हो ना, तो मिल्क सप्लाई आने लग जाती है. तो नेचर हमेशा हेल्प करता है. ये आपको सिर्फ एक डिसीजन लेना है कि मुझे करना है. मेरे पास 2 साल के बड़े भी मदर्स, आपने यूट्यूब पे देखा भी होगा किरण की स्टोरी, उसका बच्चा 2 साल के ऊपर का था जब उसने रिलैक्टेशन के लिए ज्वाइन किया था और 370 ml तक गया था. तो ऐसा नहीं है कि ये करने के बगैर मतलब काम नहीं करेगा. आपको बस उसके ऊपर वर्क करना है. और एक चीज ध्यान रखनी है, मुझे बच्चे की इम्यूनिटी पे फोकस करना है. आप बिल्कुल ये नहीं सोच सकते हो कि बच्चा मेरा अगर 800 ml दूध पीता है तो इतना मिल्क प्रोडक्शन हो जाएगा. लेकिन अगर आप शुरुआत इस चीज से करो कि बच्चे को इम्यूनिटी मिलेगी, आप उसके जो भी मिल्क प्रोडक्शन हो रहा है उससे बच्चे की इम्यूनिटी अच्छी होगी, क्योंकि इम्यून फैक्टर्स है ना उसके अंदर एंटीजेंस हैं, जो आपकी बॉडी में एंटीबॉडीज बन रही हैं, वो मिल्क में सिक्रीट होती हैं. और जब अमाउंट कम होता है मिल्क का, तो उसकी क्वालिटी भी बहुत अच्छी होती है. और आपको एक चीज ये भी बता दूं, एक सिंपल बूंद जो ब्रेस्ट मिल्क की होती है, उसमें 3 लाख जर्म किलिंग सेल्स होते हैं. तो आप सोचो कितना पावरफुल है ये ब्रेस्ट मिल्क. और आप लोग उसके लिए सोचते हो कि थोड़ा सा ही तो आ रहा है, थोड़ा सा ही तो आ रहा है. कितनी बार मदर्स मिल्क निकाल के फेंकने लग जाती हैं, ये तो खराब हो गया, ये तो रखा हुआ है, ये तो कैसे दूं. तो आप लोग ब्रेस्ट मिल्क की इंपॉर्टेंस को समझते नहीं हो, तभी आप लोग इस तरह की चीजें मन में लाते हो. आपको जब ब्रेस्ट मिल्क के बारे में पता चलेगा, आपको जब समझ में आएगा कि ये कितना ब्यूटीफुल बॉन्ड है, ये कितनी एक ऐसा क्रिएशन है जो आपको अभी 1-1.5 साल के लिए ये मिला है, उसके बाद आपका बच्चा बड़ा हो जाएगा, आप भी और चीजों में लग जाओगे. ये इतना गोल्डन टाइम है, इसको वेस्ट मत करो. आपको जहां से हेल्प मिलती हो, जस्ट गो फॉर दैट हेल्प एंड गेट योर इश्यूज रिजॉल्व. तो सरिता, अगर आप ये सुन रहे हो, अगर आप लाइव हो, तो ये बात को ध्यान से समझो कि अगर आपका बेबी 1 साल का है और आप रिलैक्टेशन पे अभी भी काम करना चाहते हो, तो आप बिल्कुल डेफिनेटली कर सकते हो इसके अंदर. नेक्स्ट क्वेश्चन है बी. नाम है, आई डोंट नो, या तो टाइपिंग मिस्टेक होगा मे बी. तो इसमें क्वेश्चन है कि बीन मिक्स फीडिंग माई बेबी, when will I be able to fully depend on breastfeeding? तो बीन मिक्स फीडिंग माई बेबी, अभी मुझे नहीं पता कि आप कोई ट्रीटमेंट ले रहे हो, नहीं ले रहे हो, क्या चल रहा है आपका। अभी आपने ये लिखा है कि I am mixed feeding my baby and when I will be able to fully depend on breastfeeding. So because I don't know what is the status of your breast milk right now, I can't answer this question like this without knowing what is the status, what is the age of your child, what is the last weight of the baby, what is the current weight of the baby, how much formula the baby is taking, how much breast milk the baby is taking, is the baby taking by direct breastfeeding, is the baby, are you pumping also? So there are a lot of things which have to be first asked to the mother, then answering these the questions like these. Okay. Next question is from Rajashree. Is it mandatory to discard milk while pumping? No. Who told you? You don't have to do that. You have to regularly pump and give full milk to the baby. Why to discard milk? It is not required. Now, for whom we advise to, and that also we don't ask to discard. We just ask to express and keep it. It is basically for the babies who are like having good weight and all that. And like sometimes I can see oversupply of milk is also there. So if there is oversupply of milk, then mother can express some milk and then feed her baby. But that doesn't mean you have to discard that milk. You can store that breast milk in your refrigerator and that can be used later on. But we never advise, or if you have somebody who has advised you about discarding breast milk, then it is not correct, Rajashree. Next question is from Ritika, who asked breastfeeding post 6 months. Again, this is a very general question. What are you trying to ask me? You're just saying breastfeeding post 6 months. So let me give you some general guidelines. Yes, you can continue giving breastfeeding to your baby post 6 months. Now, if your baby is taking solid feeds, then there is a very common question that how much time I should breastfeed my baby. So first thing, after 6 months, when you are starting solids, the baby at 6 months should take around 8 tablespoons of food per day of solids. So after giving this 8 tablespoons of solids per day, the rest amount should be breast milk. Because when we talk about solids, then at 6 months, we call it as complementary food. Okay, that is not the main source of nutrition, but yes, now breast milk is not complete food for the baby after 6 months. So that gap has to be fulfilled by the solid foods. So that solid food is the complementary food. So complementary foods will take, as I told you about the amount also, it should be around 8 tablespoons per day. So after that giving 8 tablespoons, the rest of the thing is milk, either breast milk or formula milk. If your baby is on exclusive breastfeeding, you can continue breastfeeding. But please don't think that, oh, your baby is not taking solids, so I can give more breast milk feeding to the baby. You have to always give solids also, because that is very important, that you should also start solid after 6 months. Other than that, if you are a working mom and you have to join your office back after 6 months, then during your office timings, you can pump and you can maintain your milk supply. So that way your milk supply will be maintained. So when you have asked me general things about breastfeeding post 6 months, these are the things which are coming right now to my mind. Otherwise, you can just, if you're live, then you can write your question clearly and specifically so that I can answer it. Next question is from Divya. How to deal with oversupply and fast letdown. So yes, Divya. So how to deal with oversupply is one thing. If your baby is finding difficulty to latch because of oversupply, sometimes the milk comes in a fast pressure and the baby starts choking, and sometimes the baby doesn't feel comfortable in having such a big, like good flow of milk in the mouth. So in that case, you can express the milk and keep this milk and store this breast milk, and you can feed the baby. In second thing, you can just control the flow of the milk by holding the breast and pressing the breast and just taking it back. So if you are holding the breast and taking it back, the milk supply the flow of the milk can be regulated. So this way you can feed your baby. So these two things are like there to regulate your oversupply of milk. But I would always say this is a blessed feeling. These days it is very rare to find oversupply. So if you are having oversupply, please take out that milk and you can donate it to a nearby hospital. That will be a very good thing which you can do for the society. There are a lot of babies in an ICU who need breast milk and their mothers are not able to produce that breast milk. So if you are blessed, if you have oversupply of milk, please express that milk and just share it to any nearby hospital which is there at nearby your home. Next question is from Sherwin. Sherwin says, how to breastfeed in Indian traditional sari? It's a good thing. What is the problem? So you have open browsers in front, and you can just open your... Okay. So I'm not answering this question, Mr. Sherwin. I know that you are a male because I have got your questions also. So I'm just... Okay, fine. So you can definitely breastfeed in Indian saris also, and there is no problem in feeding from Indian saris with Indian saris. Next question is from Pinky. Pinky says, my baby 55 days old, exclusive on breastfeeding, doesn't prefer left side, wakes up in 15 minutes. What should be done? My baby 55 days, so 2 months, exclusively on breastfeeding, doesn't prefer left side, wakes up in 15 minutes. So, Pinky, when you say that the baby is on exclusive breastfeeding, that means the baby's weight gain is good. And if the baby is not coming on the left side, then what you can do, you can just put the baby on the left side when the baby is little sleepy. So right now it is 2 months old. So exclusive breastfeeding, the baby is gaining weight. Then increasing breast milk supply is not the main question right now here. It is basically the baby is not coming on the left side or not preferring the left side. So what you can do when the baby is little sleepy, then that time you can just put the baby on the left side. And if it is still not working, you can express the milk from the left side to the milk supply improves and the baby starts coming on the left breast also. Sometimes when the milk supply is better on one side, they start preferring that side. So if you just see if your milk supply is less on the left side, please try to express the milk, like create more demand on the left side to improve the milk supply so that the baby starts coming on the left side also. Always do that whenever you start breastfeeding, first put the baby on the left side and then shift to the right side. So this way, when you are trying for every feeding for the baby on the left side, the baby will slowly get habitual to left side also. Next question is from Pravalika. Pravalika says, my baby is not sucking properly because of formula milk. Then Pravalika, you have to work on improving the supply. And also, as I told you, like mid-bottle feeding or mid-katori feeding or mid-palada feeding, you have to start doing it in between your formula milk and improving your milk supply, flow, and the other things which I have suggested. So this way, once your breast milk supply improves, then obviously you can get the baby on breastfeeding also along with the formula milk. And if once the baby starts gaining milk on exclusive breastfeeding, then you can definitely cut down on formula milk. Next question is from Siuli. Siuli says, how I understand my baby take sufficient milk? Siuli, it is by checking the weight of the baby. If your baby is gaining 200 grams per week and less than 3 months, then you are producing sufficient amount of milk. And if the baby is more than 3 months, baby should gain 100 to 150 grams per week. Next question is from Saroj. मेरा 3 महीने का बेबी है, मुझे कभी भी ब्रेस्ट में फुलनेस फील नहीं होती, चाहे बेबी 6 आवर्स तक भी फीड ना करे, मेरे ब्रेस्ट हमेशा सॉफ्ट रहते हैं. तो सरोज, ये जो ब्रेस्ट में फुलनेस होती है या लीकिंग होती है, ये जरूरी नहीं है कि हर मदर को हो. कभी कभी ये बहुत कॉमन है, पहले 6 हफ्ते, किसी मदर को पहले 6 हफ्ते भी नहीं होता और किसी मदर को थ्रू आउट ब्रेस्ट फीडिंग भी रहता है. तो जो फुलनेस, हेवीनेस या लीकिंग की जो बात एक यूजुअली एक धारणा है मदर्स के माइंड में कि अगर फुलनेस या हेवीनेस नहीं हो रही तो मिल्क सप्लाई नहीं है, ऐसा कुछ भी नहीं होता सरोज. आप बच्चे को बस रेगुलरली फीडिंग कराओ और बच्चे का वजन अगर बढ़ रहा है तो आपको ये बिल्कुल चिंता नहीं करनी है कि मिल्क है कि नहीं है. आपको बस हर बार बच्चे की डिमांड पे उसको ब्रेस्ट पे लेना है, ये बस आपका काम है. बाकी नेचर को काम करने दो. नेचर अपने हिसाब से ब्रेस्ट मिल्क सप्लाई को रेगुलेट करेगा, उसके कॉम्पोजिशन को रेगुलेट करेगा. आपका काम है बस डिमांड क्रिएट करना. रेगुलरली आपको डिमांड क्रिएट करनी है और अगर आपकी मिल्क सप्लाई बहुत कम है तो यस, आपको थोड़ा सपोर्ट भी करना होगा बॉडी को. बाकी अगर आपकी मिल्क सप्लाई अगर आपको लगता है 80-90% भी है तो आप अपने मन में ये मत लाओ कि हेवीनेस नहीं हो रही, फुलनेस नहीं फील हो रही, लीकिंग नहीं हो रही. आप बस आपका काम है बच्चे को ब्रेस्ट पे लगाते जाना और वेट को चेक करते रहना रेगुलरली. Next question is from Anju. My areolar area is too large, so baby cannot latch properly, or it gives discomfort to baby when I try to get proper latch. So first of all, Anju, we have to always remember that you don't have to give full areola in the baby's mouth. It is only the lower part of areola which has to go in the baby's mouth. So if you have a big areola, it is not a problem because you have to give only the lower part of areola. You don't have to give full areola in the baby's mouth. And that can be done easily by cross-cradle hold. By just having asymmetrical feeding, you can definitely do that. Next question is from Ramya. My baby's age is 3.5 months old. Still, he is cluster feeding during night times. Is it normal? So, Ramya, you have to see why is the baby doing cluster feedings. You have to check the weight. If the weight is on a lesser side and the baby is 3.5 months old, then the cluster feeding has it is basically a supply issue. And if after seeing everything that for that milk supply is good, even the weight is good, and the baby is still doing cluster feeding in the night, it's okay, it's normal. You don't have to just worry because your baby's weight is good, then nothing to worry. And cluster feeding once in a while, once in 24 hours is fine. It's not to worry, Ramya. Next question is from Kani, who says increase milk supply. Now, increase milk supply is again a very generic question. You have to specify what is the question so that I can answer. Next question is from Shamli. Shamli says, my child takes 1 hour to feed from breast. How to reduce time? So Shamli, you have to see here active feeding and passive feeding. So today you stand in front of the mirror and drink milk or water. When you are drinking any kind of liquid, you can see gulping in the neck. So that gulping you have to see in the babies, when the baby is feeding, you have to just check that gulping sign in the baby's neck. So that is called as active feeding. So if your baby is feeding for 1 hour, this is very sure that the baby is not doing active feeding for 1 hour. So you have to only feed the baby during active feeding. If your baby is not gulping, then you can just remove the baby from the breast and the baby will either sleep, or if the baby wakes up and asks for milk, then you take the baby, but you have to always ensure that it should be active feeding only. Next question is from Deepa. Deepa says pain in breastfeeding and breast and nipple severe pain. So Deepa, this looks like a latching issue. So if pain is there and if you have nipple pain, then obviously this is a very clear sign of a shallow latch. So you have to work with a latch expert. You can just reach out to the team tomorrow and get your call booked with a latch expert. She will go live with you and will help you in latching, improving your latch. Next question is from Juhi. How to get separated child on breastfeeding? I don't understand this question, Juhi. You have to just specify your question. Next question is from Pooja. How many times let baby to latch? Now it depends on what is the age of the baby. If your baby is less age, like around 1 month or 2 months, it is very common for babies to latch every 2 hours or 3 hourly. So that's fine. But if once the babies are 3 months or 4 months, sometimes you might see the babies even not latching for 3 to 4 hours, which is fine. So a gap of around 3 to 4 hours is fine. So this is all depending on what is the age of your baby, and the latching frequencies is according to the age. So because you have not mentioned the age, so I'm not able to answer you properly, but what are the general guidelines I have just told you. So these are the questions which were filled by mothers on the form. Now I'll take the live questions which are there. The first question is from Rajashree. Hello, ma'am. Is it necessary to discard milk while pumping? I think I've answered this question, Rajashree. Is it fine for Emily and hind milk gets mixed? Yeah. What is Emily? I'm not able to understand, Rajashree. What is Emily? Please make it clear. I think you are asking for milk. If you're asking for milk and hind milk, that is perfectly fine. You can mix them together. Next question is from Amrin Sheikh. Is the milk supply engorgement similar for both normal and C-section deliveries? Yes, it is it is similar for both, even for normal deliveries or for C-section deliveries, it is normal for every mother to have these kind of issues in the beginning. Next question is from Amrin Sheikh. Is breastfeeding painful at initial stage? No, it should not be painful at all. Breastfeeding should be very comfortable for both mother and the child. If there is some pain, then that shows it is a latch issue. It's basically it's a shallow latch. You have to work with a latch expert, and we have a dedicated latch expert in our team. So you can reach out to them and get your issues resolved. Next question is from Amri. Can we wear bra during pregnancy? From which trimester we should stop wearing? No, you should not stop wearing. You should continue wearing bra during pregnancy and even after delivery also. Next question is from Pinky Mirgal. My baby prefers only right side for feeding, which has affected my left side supply. It's hardly 10 ml when pumped. I want to work on demand and supply. How should I take it ahead? How should I feed him? Which side first and how many minutes so that supply increases in full system? So first, always start from the left side where the supply is less. When the baby starts getting irritated, then put the baby on the right side. Once the baby has taken from the right side, again take the baby on the left side for few seconds, so for whatever minutes the baby can stay. If this is not working for you, then you feed the baby from the right side and pump on the left side. So it will improve the supply on the left side also. Once the milk supply is improving, then you start latching the baby from both the sides. Next question is from Divya. Baby is 10 weeks old, having green frothy stools. Is it because of fore milk, hind milk imbalance? I am having oversupply and fast let down issue also. Please guide ma'am. So yes, it is because of the fore milk, hind milk imbalance, but that is perfectly fine, Divya. You don't have to worry about it. If your baby is gaining weight properly, then you can go ahead. If you are having oversupply and fast let down issues, I have already answered, Divya, for you just before, like in the questions. Next question is from Amreen Sheikh. If baby drinks from right side and sleeps, then left side is not empty. What to do? If your baby is on exclusive breastfeeding, then you don't have to do anything. Just next time feed the baby from the left side. But if your baby is also taking formula milk, then once the baby has taken from the right side and is sleeping, then on the left side you can express the milk and replace it with the formula next time. Next question is from an anonymous attendee. Milk supply is proper. I am pumping. I have resumed work. So there is very less time. But she is not coming directly on breast. Baby is 5 months old. So because you have resumed work, what you can do, you can pump with this variable pumps. There are very good variable pumps available in the market. You can contact helpline team tomorrow. They will send you some references. You can work on that. So by having variable pumps, you can definitely pump during your work hours. Now, baby is not coming directly on the breast, obviously, because there is a disruption in between when you're going for work. That's why the baby might not be coming on the breast. Just have baby skin to skin with you, lot of cuddling so that the baby can come back directly. And also try mid-bottle feeding or the mid-katori feeding so that your baby can come on the breast directly. Baby is 5 months old. That is perfectly fine. Next question is from Amreen. Should we massage breast regularly during pregnancy? It depends on what trimester your pregnancy is right now. Next question is from Pinky. Should I also do manual pumping to increase milk production on left side? How often should I and for how many minutes? So Pinky, if your baby is not coming on the breast, then what you can do whenever you are feeding the baby from the right side, the same time after finishing the baby feeding from right side, you can do pump on left side. So it should be like often as per the demand of the child. Whatever times the baby is taking feed from the right side, that many times you have to do from the left side, do the pumpings. And also you need to support your body to improve the milk supply. So you have to follow the procedures as I told you about massage and the compress and hydration and galactocox as I told you, lactomagic powder and moringa tablets. Next question is from Pinky. My baby is 56 days old and he pees around 8 to 10 times in 24 hours. But recently he has started pooping just once in 24 hours. Is it normal? Yes, it is normal. Okay. Next question is from Rajeshri. Ma'am, do you think combined feeding 2 times formula milk and 10 times breastfeeding is fine for the baby? Do you think it's always better to shift to exclusive breastfeeding? So Rajeshri, this is a very personal question. If you can ask me, I would prefer having the baby on exclusive breastfeeding for as long as I can. And then once I have to like resume to my work or I am wanting to shift the baby to the pumping or like to formula feeding, that decision has to be taken by me. Like you should be having that decision. So if you ask me personally, I would have to have exclusive breastfeeding for my child because I feel on a longer run that gives me more confidence and a better satisfaction also. Next question is from Ritika Srivastav. My baby is over 6 months and I am a working mother. I want to move from exclusive breastfeeding to formula breastfeeding. I tried pumping it with a good pump, but didn't get much of the milk expressed, not even 30 ml from both the sides. He's also going to start solid soon. So first of all, Ritika, see, when you have been on exclusive breastfeeding, when you start pumping, that is an alien feeling for your brain. The brain doesn't understand pump. So if you are doing once or twice or you're doing sometimes and you are expecting a good amount of milk, it will not happen that way. So you have to be consistent with your pumping timings and with the proper routine of pumping. So when I shift my mothers from, like, all the many working mothers need to be shifted from direct breastfeeding towards the pumping, then I give a proper protocol to them by understanding what is their need and what is the routine. So first you have to check what is your routine and what is your routine while you go for work. Accordingly, you have to plan your pumps accordingly and direct breastfeedings in between or after your working hours. So this should be a combination which you have to follow, and don't worry that your milk supply is coming less with the pump. It's okay. It will be there initially. But once you keep maintaining that pace and doing it regularly at fixed timings, definitely the milk supply will start increasing on the pumpings also. Next question is from Ritika Srivastav. How to stop breastfeeding and how to create a habit of not asking breastfeeding in the midnight. Now, it depends what is the age of the baby. If the baby is more than 6 months, basically babies get up in the night for thirst. It is very less times it is hunger. So if you still feel that the baby is hungry in the night, then the feed which we are giving before putting the baby on the like the dinner time should be more of protein rich food. So like you can give the baby, if you are a vegetarian, you can give baby some dals and more of a dal and mixing less of rice or something like that, so that the baby gets good protein in the night. If you're a vegetarian, you can give something made of egg puree or something. If your baby is more than 1 year, even you can give omelette or something like that, which keeps the baby full in the night. So protein rich food in the as the last meal will keep the baby full, and the baby will not get up in the night asking for breastfeeding. But if the baby is getting up in the night, first try to offer water to your child. So sometimes babies are usually, because they open their mouth and they usually sleep that way, so they become thirsty in the night. So first try offering water in the night if your baby is more than 6 months. 3. Baby is 2.5 months old and he laughed only for 2-3 minutes and sleeps off. I think you're asking latched. He's gaining 150 grams a week. P count is 8 to 10. Should I worry? Baby is on exclusive breastfeeding. So baby is 2.5 months, 150 grams is fine, because I was expecting 200 grams till 3 months, but 2.5 months maybe early signs of growth spurt. So it's fine. Just keep a tap on the weight and just keep checking the weight. If it is constantly increasing to 150 grams a week, then it is good. No worries about it there. Or for a few days, what you can do, once the baby finishes breastfeeding, you just like hand express or pump for 5 minutes and keep giving that milk to your child. So that is hind milk which you are giving to your child. So the baby will gain better weight. Next question is from Pinky. Eating meals during breastfeeding, does it give nourishment to baby or increase the nutritional value? No, your eating will not like give any nourishment in a way that you are eating something will go to the baby. It will improve the milk supply, it will improve the milk flow, it will improve the milk quality, and that also depending on what nutrition you are taking. It doesn't mean you take lot of eatings, like lot of carbs, or you eat lot of food that will increase. No, basically it is the quality of food which you are eating. So if you have a good nutrition and a good protein in your food, that will improve the quality of the breast milk. Next question is from Pinky. Have started Lactomagic powder and Moringa tablets. How much time does it take to see results? Right now, I don't know, Pinky, who has prescribed you, what doses you are taking, and how long you have been taking. We need to first understand that usually I ask the mothers to take it for 7 days and come back to me, discuss the results with me, so that I can change the dosages if required. Next question is from Isme Begum. I had dengue. I was exclusively breastfeeding. Now milk reduced. Will it increase later? Taking plenty of fluids. Baby is 3 months old. Yes, Isme, you can definitely increase the breast milk supply again. So because you had dengue, that weakness would be there in your body, and that's why the milk supply reduced. So only taking of fluids is good. You are taking plenty of fluids, but also work on improving the flow and improve the quantity of milk supply by taking the box, which I suggest, like Lactomagic powder and Moringa tablets. I also suggest some more medicines, but that has to be always given one-on-one, because medicines need to be forced to understand, whether it is required for the mother or not, and should be prescribed that way. Next question is from Pooja Goyal. My baby is completely on formula milk. He sleeps from morning 9 a.m. to night 2 a.m. Only wakes for milk only and awakes in night from 2 a.m. to 9 a.m. Is it normal? No, Pooja, this doesn't look normal. And because your baby is on completely formula milk, you have to increase breast milk supply and you have to go for relactation. Pooja, please don't waste time here. Reach out to the team tomorrow and get a appointment set up for working on relactation. Next question is from anonymous attendee. Baby does lot of passive feeding and will sleep only after sucking breast for 1 hour. Baby is 4 months old. Also, weight gain and wet nappy are adequate. That is fine, but you have to always feed the baby on active feeding only. This passive feeding for 1 hour will make you very tired, and you will not be able to sustain it. Pooja, baby is 40 days old. Pooja, baby is 40 days old and is on exclusive formula feeding. Please reach out to the team tomorrow and get this resolved. You can definitely do exclusive breastfeeding. You have to work on it fast. Next question is from Ramya. My baby's age is 3.5 months old. Weight is good, gaining 200 grams per week, but he's spitting all the milk after feeding. Is spitting normal? For 3.5 months old, 150 grams is on a higher side. This 200 grams look on a higher side. But if the baby is on exclusive breastfeeding, it is fine. Little amount of spitting is fine. But if it is like too much, then just try to feed the baby for a lesser time, because this spitting shows the sign of either it is because of overfeeding or you're not burping the baby properly. Try to burp the baby in between and see if this spitting reduces. Next question is from Ritika Srivastav. Till what age should breast milk be given? So Ritika, again, this is a very personal thing. Usually WHO says 2 years and above. I say till when mother and baby are comfortable. I would continue giving breastfeeding to my baby if I want and my baby wants. So this is a question which you have to decide. WHO says 2 years and above. Next question is from Sonali Gume. Hello ma'am, मेरा baby 5 महीने का है. Still my milk production was 0 and my baby was crying and pushing the breast while breastfeeding. So Sonali, आपका बच्चा already 5 महीने का है. Please don't waste time now. Milk supply is 0 आप कह रहे हो. When your milk production is 0, this is a case of relactation. Now please don't waste time. Your baby is already 5 months. The baby 5 months have already gone. Now there is no time of experimenting or taking free advices like this. Please reach out to the team tomorrow and get a consultation set up for you, where we can guide you and give you protocols for improving the milk supply. Next question is from anonymous attendee. What are the charges of consultation? You can just drop in a mail and we'll refer you to our inquiry team and they will guide you about the consultations, because that needs to be understood. What are your requirements? Accordingly, they'll tell you about it. So just drop in a mail and we'll direct you to our inquiry team. Okay, girls. So the questions are done for today. So Nusrat Sheikh raised hand. Please write your question on the Q&A box, Nusrat. I hope this Q&A session is helpful for you all. If yes, please just give me your feedbacks in the Q&A so that I can do more Q&A for you all regularly so that your questions are answered. And if you have some feedbacks, like if you want me to just improve on something, please write in the Q&A box so that I can improve it next time. Pinky says, thank you so much, most welcome. Divya says, thank you so much, most welcome. And thank you for these hearts. It's a blessed feeling to see those hearts moving on the screen. That's a great thing. Divya says, excellent session. Thank you so much, Divya. Okay, girls. So take care. This is already 1 hour and I'm happy that you all have answered. You have all taken so questions so well and taking questions. And Rajeshi says, very helpful, ma'am. I love your sessions. I love your way of answering questions. Thank you. Thank you so much, Rajeshi, for your kind words. And it's always a pleasure to help people. And yes, Nusrat, I'm waiting. You are written, ma'am, please. Please write your question. I'm waiting, Nusrat. Don't worry. Please write your question. So anybody who wants to have a talk with me, let me connect for 5 minutes. Please raise your hand. I'll try to unmute you. Somebody who wants to talk to me on direct session, just raise your hand. I'll unmute you. I can't see. I don't know whether you all are having that option of raising hand or not. I'm not sure. Swapnali is there. Awesome, Swapnali. Good to see you. And Mr. Sherwin, please be beware. I am understanding who you are. If you are trying to put some fake questions and spam the meeting, I'll just kick you out. And I'm following you because you have been following me from Instagram, and I am seeing that you are not a genuine person. The question which you have put in the question is not good. Sherwin, I'll take a legal action against you if next time you put anything like that. And I know who you are. So beware, and you know how ugly it can go. And I can take legal action against you if you are disturbing any one of us. Okay, Mr. Sherwin? And I am very sure you are not a genuine person. So I'm removing you from now. Because I hope I've removed that person. Actually, I have been seeing this guy. I think he's a guy. I'm not sure whether he's a guy or a girl. But some days ago, I got a message on DM on Instagram that I want to learn about breastfeeding. I want to know more about. When I saw a profile, I saw a male picture there, and there was not much content there. But it just made me a gut feeling that it's not a female. But still, I didn't say anything. But I think on my story somewhere, they got the link for this 30 days email course and they joined there, because today he has put up a question at how to breastfeed in a sari, which sounded very different for me. And acha, I was in a flow to answer the question. I just started answering it, just like seeing that it is coming from a mother. But it suddenly struck me, why would somebody ask a question like how to feed in a sari? This is something not asked by mothers usually. So it just went to my mind, this Sherwin person is something fake. So I just removed him from the meeting, and next time I'll make sure that if I see this man there again, I'll remove him, and I'll remove him from the 30 days email series also. But these people, they will keep coming on by other names or something. It's fine. If we are like genuine, we are answering the questions generally, there is not an issue. Maybe we get some knowledge about breastfeeding and can help some people, not taking in a spam way. It's fine. Okay, so I can see some questions there. So Nusrat says, मेरा बेबी बॉटल फीड करता है, वो 5 महीने का है और मेरे पास आता नहीं है. I think it would be fine. So नुसरत देखो, बच्चा 5 महीने का है, बच्चे ने 5 महीने अभी तक फीडिंग नहीं किया है डायरेक्टली, उसको नहीं आता ना फीडिंग करने को, तो ठीक है, दैट्स ओके. हम क्या करेंगे, बॉटल फीड के बीच बीच में ट्राई कराएंगे. पहली चीज देखो, आपका मिल्क सप्लाई कैसा है. अगर मिल्क सप्लाई कम है ना, तो फिर कैसे आपका बच्चा आएगा. बच्चे को बॉटल का आदत है, उसको फ्लो का आदत है, उसको मिल्क पीना है, उसको भूख लगा है. अगर ब्रेस्ट में मिल्क ही नहीं है तो बच्चा कैसे आएगा ब्रेस्ट पे. तो पहली चीज देखो कि मिल्क है कि नहीं. अब दूसरी चीज, अगर मिल्क है तो क्या करोगे, बच्चा जितनी बार भी बॉटल पीता है या जितनी बार भी ऊपर का दूध पीता है, हर बार उसको बीच बीच में थोड़ा थोड़ा ट्राई करो. आधी बॉटल पे ट्राई कराना सबसे अच्छे रिजल्ट्स देता है. आधी बॉटल पिला के बॉटल हटा के एक बार बच्चे को फिर से ब्रेस्ट पे लो. ये चीज लेकिन आपको हर बार करनी है. आप अगर बच्चा आपका 8 बार दूध पीता है और आपने हर बार ट्राई किया और बच्चा 2-3 बार भी आया ना, इट इज वेरी गुड नुसरत. लेकिन ये आपको रेगुलरली करना है, रोज करना है, और बीच बीच में हर बार ट्राई कराना है. साथ में बच्चे को स्किन टू स्किन रखो. बच्चे को फीडिंग कराते समय बच्चे को जब डकार दिलाते हो तो बच्चे को अपने से चिपका के रखो. तो बच्चा क्या होगा, स्किन टू स्किन से उसकी आपके साथ बॉन्डिंग अच्छी होगी. तो इस तरह से बच्चे के ब्रेस्ट पे आने के चांसेस इंप्रूव हो जाएंगे. ठीक है नुसरत. नेक्स्ट क्वेश्चन इज फ्रॉम Nureen. Hello ma'am, I would like to know if taking supplements can increase milk supply. So Nureen, it is always about what is the demand. It is not like any random thing will help you, but it is always depending on, and you would be like, I can tell you that it is always as per the improvement, we have to improve the dosages also, change the dosages. So what I work for mothers, I start with a standard dosage, and then Depending on what results I am getting, I change the dosages accordingly. Now, this may vary because every mother is different. Some mothers will give, initially they will give me, but not like initially they might not give that better results, but they have to be consistent into that. For some mothers, it takes little time for the body to show results. And once it starts showing results, it moves very well. And it is not only about the quantity, it's also about the quality of breast milk. So I have Swapnali here. I think this is the same Swapnali here. And I know about her breastfeeding journey, if this is same Swapnali. So today only I think I had a discussion with her. So it is not only about the quantity of breast milk, it is also about the quality of breast milk. So by even lesser amount of breast milk can definitely help to improving your baby's weight, and it will stop the progression of formula milk. And even sometimes you might feel that the formula milk going down also. So it is not only about improving milk supply, it is also about improving the quality of milk supply. Now, when you ask about taking supplements will increase the milk supply or not, this has to be worked with the mother. It is not a general thing which I can answer. I have to know first what is the status, what is the present status, and accordingly I can advise whether supplements should be taken or not required. And if taken, how much should be taken. Swapnali says, thank you, ma'am. Every session of yours is so insightful. I'm so happy and I'm so glad, Swapnali, that you like this session. फिर नुसरत बोलती हैं, रोता है, फीड नहीं करता और अब सप्लाई भी जीरो है. तो देखो नुसरत, आपने खुद बोला कि सप्लाई जीरो है. अभी सप्लाई जीरो है तो बच्चा कैसे ब्रेस्ट पे आएगा? बच्चे को भूख लगा है, अगर ब्रेस्ट पे दूध ही नहीं है तो बच्चा कैसे पिएगा? अब आप बोलते हो कि बच्चा फीड नहीं करता इसलिए मिल्क नहीं है तो फीड नहीं करता. अब ये दो चीजें आपस में लड़ रही हैं. दूध नहीं है तो बच्चा फीड नहीं कर रहा, बच्चा फीड नहीं कर रहा तो दूध नहीं हो रहा. लेकिन अभी हम क्या कर सकते हैं, अगर हम मिल्क की सप्लाई को बढ़ा के एटलीस्ट पंप करके अगर हम बच्चे को बॉटल में दे लेंगे तो अभी हमारा एक काम तो होगा ना. एक बार मिल्क सप्लाई थोड़ा इम्प्रूव करने दो, फिर उसके बाद हम ब्रेस्ट पे लाने के लिए भी ट्राई कर लेंगे. बट मेन चीज है बच्चे को माँ का दूध मिले. ये चाहते हैं ना हम नुसरत, बच्चे को माँ का दूध मिले. पहला चीज है बच्चे को माँ का दूध मिले, चाहे वो बॉटल से ही हम क्यों ना देना पड़े. फिर उसके बाद एक बार मिल्क सप्लाई इम्प्रूव होगी तो हम बाकी चीजों पे भी वर्क कर सकते हैं. ठीक है. स्टार्टिंग में फीड करता था बट फ्लैट निपल होने की वजह से प्रॉपर लैच नहीं होता और पेट नहीं भरता. देखो, फ्लैट निपल, इन्वर्टेड निपल और ये सब से मैं सुन के बहुत परेशान हो गई हूँ. फ्लैट निपल, इन्वर्टेड निपल, ये सारी चीजें निपल के अराउंड घूमती हैं. बच्चे को हमको एरियोला से फीडिंग करानी होती है. निपल अगर फ्लैट है, इन्वर्टेड है, लेकिन अगर आपने सही टेक्निक से बेबी को ब्रेस्ट पे लिया है तो आप डेफिनेटली बच्चे को फीड करा सकते हो. अब बात क्या होती है, क्योंकि हम लोगों को बचपन मतलब जैसे बच्चा होता है कोई ना कोई आकर के बोल देता है, अरे तुम्हारा तो फ्लैट निपल है, अरे तुम्हारा तो इन्वर्टेड निपल है. अब मदर का कॉन्फिडेंस गिर जाता है. अब वो हमेशा अपने आप को डाउट करने लग जाती है, मेरे साथ तो ये दिक्कत, मेरा तो फ्लैट निपल. देखो, अब आपको प्रॉपर गाइडेंस की जरूरत होती है इन सब चीजों में. इसीलिए इंपॉर्टेंट है कि आप जल्दी से जल्दी किसी प्रॉपर लैक्टेशन कंसल्टेंट को दिखाइए तो आपके दिमाग से ये सारी चीजों को निकाल सके. तो इसलिए नुसरत, अब देखो जो हो गया सो हो गया. अभी बच्चा 5 महीने का हो गया है. अभी हमको बेसिकली फोकस करना है कि बच्चे को माँ का दूध मिलना शुरू हो. माँ का दूध मिलने लग जाए, मिल्क सप्लाई इंप्रूव हो जाए तो हम लोग एक बार डायरेक्ट ब्रेस्ट फीडिंग पे ट्राई कर सकते हैं. ठीक है. Says another question, can electric breast pump increase the quantity? So again, see one more thing. It is not about electric breast pump or manual breast pump. It is about ease of pump. If you are comfortable doing with manual pump, that is also working. If you can work with electric breast pump, it will also work. Basically, it is the demand. If you are creating that demand by manual pump or electric pump, that is not a case. It is basically the ease. If you are finding easy with the electric breast pump, then obviously your compliance to the protocol will be better. So this you have to understand. It is not about electric breast pump producing more milk. It is about your regular efforts into the process of which will improve the milk supply. Got it? Okay, girl. Sorry. So let's end the session now. Take care, everyone. Have a very beautiful Sunday and weekend for all of you. So this week we already enjoyed with Raksha Bandhan, and now let's enjoy the weekend also. So all the best, girls. Enjoy your time. All the best. Take care. Bye-bye. Good night, everyone.